This video will cover meibomian gland debridement and expression. The meibomian glands are first addressed with debridement, for which I use a golf spud that is in your foreign body kit. This golf spud is gently moved along the lid margin, taking care not to scratch and being mindful of the contour of the lids. The lower lid is easier because it can be pulled away from the eye. The upper lid, again, is everted, as you can see here. Another trick, should this not work or the patient be very comfortable, is having the upper lid overlap the lower lid when the patient closes. This will protect the cornea and ensure that you don't accidentally touch the eye. After debridement of one eye, I tend to move on to the other. And similarly on the right eye, debride the lower lid first, asking the patient to look up, and then asking the patient to look down, or as I showed in the previous section on the left eye, asking the patient to close the lids and having the upper lid override the lower lid to protect the cornea. We then move on to expression. I like to use an meibomian gland expressor that tends to be pretty comfortable. The eye is anesthetized with proparacaine, and make sure that again you're mindful of the contour of the lids when you insert the expressor, that it follows the lid and is not inserted parallel to the cornea. The other hand is used to stabilize the lower lid so you don't accidentally slip and pinch the lid, because both sides of the expressor are smooth, which is more comfortable, but also can mean that the lid is not completely stable. Once you see a small amount of meibomian being expressed, you do not need to apply more pressure, but rather just wait, maintaining the same pressure until you see the expression stop. The grading of the expression is both done by quality, as well as how many glands you're able to express, as well as how much pressure you need to apply. The upper lids tend to be easier. Again, as you can see, I evert the upper lid away from the eye, insert gently the expressor, and have the patient look down, decreasing the chance of accidentally injuring the cornea. The upper lid should be an easy expression with mostly very easy flowing oil. The lower lid is the lid that tends to need more pressure. Again, you see the stabilization technique with the second hand. And you can also see on the other side the external view, and as you can see I go across the lid. You can flip the expressor to apply more localized pressure should you have a hard time expressing the glands. Upper lid, again, evert above the tarsus to put the upper lid away from the eye and to be able to insert the expressor. I hope this was helpful.